Hello, everyone, and welcome back to XoomMD Podcast Corner. I'm Adil Saad, the commercial growth lead at XoomMD. Over here, one of the things we enjoy most is helping physicians share their expertise beyond the clinic. That's exactly what the series is about, bringing expert insights to patients and sports fans alike. Today, I'm delighted to be joined once again by Dr. Akhtar, a doctor of podiatric medicine, foot and ankle specialist, and founder of Optical Ankle in New Jersey. Dr. Akhtar, Assalamu alaikum. Welcome back. How are you?
Very good. Thank you. Thanks for having me.
Amazing. Dr. Akhtar, this podcast is divided into three segments. The first segment is called Meet Dr. Akhtar. So, to start off with the first question, Dr. Akhtar, for viewers meeting you for the very first time, could you please tell us about yourself, optical ankle, and what really inspired you to pursue podiatric medicine to begin with?
Yeah, okay. Thank you. So, my name is Dr. Afan Akhtar. I've been a physician in northern New Jersey, predominantly Fawley, Wayne, and the Clifton area since 2007. So, approximately 20 years practicing in the state of New Jersey. The emphasis is a lot on injuries, but to anything essentially in the lower extremity. My inspiration in terms of coming and practicing in the area of lower extremity surgery and medicine was through my passion of sports. But I actually got, believe it or not, accepted into dental school at the same time in California. I steered and veered towards podiatric medicine simply because I'm passionate, like I said, with sports, but also I wanted two-way interactions. You can't get too much of that in dentistry.
That's true. That's true. That's a very good point. Lovely. Dr. Akhtar, before we dive into today's case, what's one misconception people commonly have about foot and ankle injuries?
Yeah, that's a very good question and very commonly asked. Low extremity injuries or pain and discomfort is relatively common simply because obviously it's our weight bearing area. People put a lot of pressure on it. Obviously, when they run, jog, when things drop naturally through the gravity, sometimes they land unfortunately on our feet and so forth. So misconception is that pain is relatively normal. I can tell you for sure that it isn't. And yes, the pain can subside after a day or two,
Mm,
but a lot of injuries can be prevented, both short term and long term, if it's looked at. So again, like I said, pain shouldn't be considered normal.
right, right, perfect. Because I know that people who are at least 40 or 50 plus, pain for them, they just believe that, you know what, it's a part of their normal life and they just live with it. But like you mentioned, pain is not normal. And I think if somebody experiences pain, they should have them checked. Lovely. Now, today we're looking at a real FIFA World Cup injury involving Christian Pulisic. Last night was a lovely match between Spain and Argentina. And I want to ask you, what team were you supporting last night?
Whether you can tell or not, my accent is English. So I was born and raised in London in the UK. So
Yeah.
my team was England. Unfortunately, the team that beat us played in the final yesterday. So consequently, my team who was supporting was whoever was going to play against Argentina.
Okay.
So
So,
for you Messi fans, yeah, sorry about that. Everyone ultimately appreciates and respects Messi, but it doesn't
yeah.
mean I need to respect the team.
Fair enough. Well, I'm glad Spain won last night. Now,
Football won last night.
well, yes, football won last night. That's very true. Uh, Now we're going to start off with segment number two, Dr. Akhtar, which is the FIFA World Cup case. I want to ask you before we start, have you seen the video clip of Christian Pulisic and his injury? So this is the FIFA World Cup case, Dr. Akhtar. Now, before we move on, here is a video clip for the audience. Now, watching that clip alone, Dr. Akhtar, what immediately stands out to you?
To be honest, it looks like a normal football incident. Agree?
Okay.
But everyone's threshold of pain can be different. And naturally, when Pulisic, I'm actually aware of this game. So Pulisic actually had to limp out eventually after a few minutes of playing after that particular injury.
Yeah.
And what I've been made aware of is the fact that it wasn't a break or a fracture, as was indicated, I think, initially, but more of a contusion. So again, as I stated, obviously collisions occur in the game of football, soccer, whatever you want to call it. And in
Yeah.
this particular case, it was considered a bone bruise, but the mechanism of injury was two players interacting, and there was a little bit of a collision and a foot incident where I think the cleat of the opposing player made contact with the lateral malleolus, which is the outside of the actual leg or ankle.
Right.
Yeah, so ultimately it ended up being a bone bruise. Unfortunately, a common injury. But these type of injuries occur quite often, and it's how you protect yourself. So for the viewers, I'm not sure how familiar you are with the game of cricket, but there's padding everywhere, both in your arms, forearms, legs. Likewise, in American football, you've got helmets, shoulder pads, and so forth. In soccer, we have shin pads.
Yeah.
So yeah, they protect the anterior front of the actual leg or the lower leg, but not so much the ankle where this particular impact occurred. Interestingly, my son, who's named after a famous football player, actually has a shin guard that encompasses that ankle for the purpose of or to prevent these type of injuries from occurring on him. Naturally, you can't stop it, but at least you can limit the onset of some of these acute injuries. And so ultimately, you do want protection or padding in those areas. Like I said, my son's shin guard is actually incorporated within a sock or an ankle brace.
Right.
So there's a shin guard on the front, there's a padding on either side of the ankle bones, which is where I believe Pulisic had his injury. And if you don't mind, I can elaborate slightly more. My son's football boots are next to me right now, or cleats, whatever you want to call them. And if you're familiar with a new disregard the fact that it's a little bit dirty right now, but it's what I have available.
Yeah.
But this is a relatively new pair of cleats, and it's very light, very low profile, and it's designed to, or it's implied that this will make it faster. But the reality is, when it's light, it's naturally not going to have too much padding, and there isn't much. I'm actually not a fan of this material. And you can only imagine if someone's foot lands on top of this, you can break bone quite quickly, quite easily. So as a result, just last week, I decided, you know what, let me get him some classic football boots with cleats. And that's this.
Yeah, these are better for sure. Yeah.
These are much more classic. Granted, it's slightly heavier, but it's not supposed to impact your game in any negative manner. And as far as the padding, I'm not sure if you can get a good view or glimpse.
I can see.
But it's made out of leather, it's classic leather, which is naturally has some buoyancy and some density. But there's some proper strength to it. So if, God forbid, someone does land on this shoe or this foot when someone's wearing it, you would think there's some compensation for it.
Yeah, compared to the one you showed earlier, that was just a plain cloth. Somebody steps on it, essentially your bone is gone. But with the black one you just showed, there's definitely some little protection that could, help with the overall maybe causing less impact on the foot. Perfect, thank you. Now,
basically a physical buffer. You want a physical buffer, essentially.
Basically, yes, perfect. Dr. Akhtar, now imagine that Christian Pulisic walks into your clinic the very next morning. Yeah, how would you evaluate him, and what would you be looking for during that first assessment?
Yeah, so this is, and like I said, it's very common for people like this to present in my office. And the first thing I'll do is I'll assure them that they're in the right place. But besides that, we do an exam, check for any bruises, check for any swelling. We'll do a physical exam, assess it, obviously see where his pain threshold is, try to identify exactly where that pain is coming from. But ultimately, we naturally get X-rays, which we have in-house. So we do X-rays, try to rule out any pathology or obvious injuries. But if there's still some doubt, in reference to what we're seeing in an X-ray, because X-rays are brilliant, they're actually very good, but it's not all encompassing. It doesn't necessarily give you all the results you're looking for. Because in fact, you can miss a fracture quite easily. A stress fracture or an initial acute fracture can be missed. And lo and behold, 2 weeks later, you can start seeing bone growth, which implies that it was broken previously. So we do. If that's the case, and if we are still suspicious, and I guess we'll get to management later, but if we're still suspicious, then I may order another type of image, whether that's a CAT scan to identify bone more closely, or an MRI, which picks up both bone and soft tissue.
Lovely. Now, Dr. Akhtar, how does that diagnosis change your treatment plan, and what does recovery typically involve?
Okay, so like I said, we make sure we clinically examine. We done the diagnostic studies. once something is identified, now whether it's broken or not, or whether it's a sprain or not, the reason why they're in the office is because there's pain. The reason why they're in the office is because there's swelling or
Yeah.
there's bruising. So if any of those things occur, we're going to encourage our patients to rest it, ice it, elevate it, and provide some form of compression to reduce that inflammation. If they're able, take anti-inflammatory medication.
Mm-hmm.
And again, if there is a suspicion of a break or a sprain, it's not going to unfortunately resolve within 24 hours.
Yeah.
It can take some time. In case of breaks or fractures, it could take 6 to 8 weeks. So we protect it. We give them a protective boot that I'm sure you've seen people wear. And if there's something very obvious and looks like there's some type of dislocation, then
Mm-hmm.
surgery is indicated potentially, and then that will happen. The good thing about these type of injuries is that once again it's identified, it's relatively easy to remediate, and it's not nothing complicated. And as long as you're compliant, like I said, rest it, ice it, compress it, and elevate it, you
Yeah.
will feel better.
Perfect. Now, Dr. Akhtar, one question that every sportsman asks is when can the player come back? Now, from a specialist perspective, what determines whether an athlete is truly ready to return back to sport?
Good question again. I routinely follow up with my patients, especially actually for most, and if not everyone. I follow up my patients routinely, whether they think they need the visit or not, because I want to give them assurance that what they're doing is correct, and if there's any reminders about something that they need to do,
Yeah.
I'll do that. But so routinely see them every week to 2 weeks. Make sure that we are seeing healing if there is a break or a fracture.
Mm-hmm.
Um, and then in terms of getting back to rehabilitation, physical therapy is a very important component. So therapy is encouraged, and typically encouraged 3 times a week for 3 to 4 weeks. Between the patient, myself, and the physical therapist, we'll slowly get the patient back to where he or she needs to be.
Perfect. Perfect. Thank you, Dr. Akhtar. So this was our FIFA related segment, and now we move on to the third segment, which is the last segment called Takeaway. Dr. Akhtar, for everyone watching who plays football, runs, goes to the gym, or simply leads an active lifestyle, what's the one piece of advice you would give to help prevent foot and ankle injuries to the people?
Very good question again. um, my take home is prevention. So it requires just a moment of your time to get
Yeah.
seen by a professional. And granted, when someone has any type of pain or discomfort, do the common sense thing, and that's rest it. Try to avoid something that's going to cause a further discomfort. It should be obvious. Applying ice is never going to do any harm. So do those two important things. But ultimately, take a little bit of time and get seen by a professional, regardless of where in your body it hurts. Get seen by the right professional. Again,
Mm,
the worst thing is just a moment of your time, but the ultimate goal is for you to get better short and
yeah.
long term.
Perfect. That's amazing, Dr. Akhtar. Now, with that, we are going to close the podcast. Dr. Akhtar, thank you so much for joining us again and sharing your expertise. If you would like to learn more about Dr. Akhtar and optical ankle, we will leave all the details in the description below of this email. Dr. Akhtar, once again, thank you so much for your time.
And thank you, Adil.
Appreciate it.